A couple of comments about policy rescissions. This language is very specific, and it deals with retroactive cancellations, and it tightens up the regulations so that it has to be intentional fraud or misrepresentation. So it's a very defined definition when insurers will be allowed to cancel coverage retroactive. It doesn't change prospective cancellations. Insurance companies typically have underwriting guidelines. Groups have to meet certain criteria in order to qualify as a group plan. And if you fail to meet that criteria, you may be at risk for cancellation. The law does not address that or change that. Those are still allowed. One of the questions that gets asked pretty frequently is, well, what if I have an employee who gets a divorce, comes to me a month later to let me know that that has occurred? Will we be able to have a retroactive cancellation? And based on what we know at this point, that would seem to be allowed, because it is a definition of eligibility. Because at the point that divorce became final, that dependent spouse was no longer eligible, and it appears that those type of retroactive cancellations aren't going to be impacted by this particular provision of health care reform. In 2014, there are a couple of noted items. The no pre-existing condition waiting period broadens out to encompass adults in 2014, and there will be a ban on waiting periods. Back when I started in this business many years ago, we used to call those probationary periods, and now the correct term is company-imposed waiting periods. That point of access to the insurance plan can be no greater than 90 days. If you're a small employer in the state of Kansas, that wouldn't be an issue for you, because under Kansas statute that's been out since 1992, that defined waiting period was already no longer than 90 days for medical coverage. If you're a larger employer, this may require some adjustment on your behalf in 2014 to make sure that you're in compliance with that provision. Okay. So Terry's going to cover what happens if you lose your grandfather status and what you have to comply with, and then we'll move back into a discussion on the triggers, what happens, and why it may or may not be important to consider loss of grandfather status a vital issue.
As Karen indicated, there's been a lot of discussion about what applies to grandfathered plans and what doesn't apply. And if you did not have a grandfathered plan as of March 23rd, 2010, or if something happens that causes you to lose your grandfathered status, then these are some requirements that are going to apply to you. Starting in 2010, you will be required to offer certain free preventative services. Now, they have not yet determined exactly what constitutes free preventative services in its entirety, but we know that certain things will be included, and those include things like annual well woman checks, annual physicals, and that kind of preventative services that is designed to help your employees avoid more serious illnesses. And that kind of coverage has to be provided without the usual kinds of copays and charges and whatnot that goes with it. I've seen some figures from folks in the insurance industry that say that providing that kind of free preventative care is likely to drive up insurance costs, but it would be by a fairly small amount, because typically those aren't big dollar items, and could serve to prevent more expensive items down the road. If you do not have a grandfathered plan, then there will be new limitations on out-of-pocket costs. If you do not have a grandfathered plan, then there are changes to your employee's ability to designate their primary care physician. As you know, currently, if you have a plan in place, normally your plan lists who is included in the group and who can be designated as a primary care physician. If you don't have grandfathered status or you lose that grandfathered status, that becomes more open to your employees to select who's their primary care physician. Non-grandfathered plans or loss of grandfathered plans entitle employees to clinical trial participation rights starting in 2014. If there's a experimental drug or an experimental procedure that employees might want to use, then that becomes more available to them without the use of the grandfathered plan. If you don't have that status, then starting in 2010, there's a mandatory appeal process. And those of you who've been dealing with insurance for a long time know that there's always, or nearly always, been some kind of internal appeal process within your insurance company. If one of your employees submitted a claim and it was denied, then your insurance company has been required to provide an internal appeal process where that insured can challenge that decision. Now, in addition to that, there's going to be some kind of external appeal process. That is going to be subject to regulations which have yet to be provided. We don't know who's going to provide the appeal, and we don't know what it's going to take to appeal. But if you're not in a grandfathered plan status, your employees and insureds will have the ability to pursue that external appeal process in addition to the internal one. Premium increase reviews. If you're not a grandfathered plan status, then starting in 2011 and going forward, the Department of Health and Human Services reserves the right to review and approve increases in your premiums. And if they believe some premium increase is unreasonable by a definition that has yet to be provided, they can tell your insurance company, sorry, that's too much, and you can't increase the premiums to that extent. There will also be required for non-grandfathered plans reports from the insurance companies to the Department of Health and Human Services reporting on the quality of services provided by the plan. They have to divulge how many people are insured, and what amount of premiums are being collected, and what services are being provided, and the efficacy of those services. And they have to be able to convince Health and Human Services each year that they're providing a good product that's leading to better health coverage. Starting in 2010, if you're non-grandfathered, there will be differences in the non-discrimination testing. As many of you know, previously, if you had a self-insured plan, you were required to conduct certain testing to see if you were providing different coverage to folks who were your high-income earners, your executives, you know, the owners of the company. And those rules only applied to self-insured plans. Nobody cared if you were making those kind of distinctions if your plan was fully insured. But now, if you're not grandfathered, that kind of high-income discrimination testing is going to apply whether you're self-insured or insured externally.